Good day everyone. Today we will discuss a critique paper about a research article entitled Cytogenetic and Fluorescence in situ hybridization profile of pediatric acute lymphoblastic leukemia in a university hospital in South India. But first, a little information about the journal. So here's the reference for the research article that I found. This is from the book entitled Medical Principles and Practice Volume number 13, number 6, that was issued ago on the month of December, 3 years ago. And please take note that here are the keywords that will mentioned a lot throughout this video. And here is the summary of the research article. Here you can see the main purpose, and that is to examine a specific kind of leukemia, also known as ALL, acute lymphoblastic leukemia, using cytogenetic analysis and fluorescent in situ hybridization. The main sample in their studies are specimen of bone marrow that were obtained from a young patients combined with multiple reagents, as you can see on the screens. And as mentioned before, the method to examine this kind of disease are cytogenetic analysis, particularly the standard gem-sustaining and interface FISH or IFISH. From their study, they conclude that between 55 to 89% of pediatric patients diagnosed with ALL exhibit chromosome abnormalities detectable through traditional cytogenetic methods and FISH. Further variability depends on different factors such as size of the patient's cohort studied, the reporting year, and the specific population examined. In the study, 29.5% of patients displayed chromosome anomalies, while 46.4% exhibited non-random abnormalities identified through the interface fluorescent in situ hybridization. Furthermore, a notable proportion of patients demonstrated the acquisition of RUNX1, KMT2A, and ETV6/RUNX fusion. So now let us proceed to the actual critique of the research. So let's start with an introduction first. Acute lymphoblastic leukemia or ALL is a type of blood cancer that occurs when the bone marrow makes too many of white blood cells called lymphocytes. These stand out as the most prevalent hematologic cancer identified in pediatric population, constituting roughly 25% of cancer diagnosis among children younger than 15 years of age. And to further evaluate this prevalent disease, a group of researchers from India dedicated their time to evaluate the cytogenetic and fluorescent in situ hybridization profile in children with acute lymphoblastic leukemia referred to a university hospital in a 5 to 6 month duration. While there is no hypothesis or research question that has been specifically stated in the study, it primarily showcased or report what would be the frequency of the chromosome abnormalities from pediatric patients with ALL treated with a single university hospital in Chennai between 2014 of October and April 2020 using G-banding and IFISH analysis. This research was carried out within the Division of Pediatric Hemato-Oncology, and it has a partnership from the Department of Human Genetics, and this is all located in Chennai, India. And around 91 patients underwent cytogenetic investigation, and all of these patients are younger than 18 years at the time of diagnosis and both undergoing for the treatment of ALL. And since this is a study concerning about children, an ethical consideration was first approved by the Institutional Ethics Committee. Here you can see the reference number, and it has a consent also from their parents. As mentioned earlier from the previous slide, the bone marrow is the main sample that was used, and this aspirate sample was conducted and processed for karyotyping following the standard procedures. A minimum of 10 metaphases were examined, and any numerical or structural chromosome abnormalities detected and documented according to the ISCN 2020 guidelines. Fish using commercial probes was performed as per the manufacturer's protocol and included the following such as the dual color, dual fusion, translocation, and rearrangement probes. And standard descriptive statistic was used to analyze the data, and the categorized data were expressed as both number and percentage. In their study, they used bone marrow as their main sample for diagnosing ALL, but it could raise some potential concerns because those young patients may experience a discomfort, and the bone marrow examination sites could have a long-lasting implication, which is not a good thing for a patient. So an alternative could be done, such as peripheral blood smears. From the studies of an author, a researcher, Costan Smith, and his researchers in the year 2002, peripheral blood was remarkably similar to those obtained in the bone marrow, irrespective of the time point at which they were measured. The use of peripheral blood would allow closer monitoring of leukemia while sparing patients the discomfort of the bone marrow aspirations. Now let us proceed to the results and discussions of their studies. During this 5.5-year time frame, a collective sum of 91 patients underwent cytogenetic examination either to chromosome analysis, which is G banding, and iFISH, or a combination of both. First, karyotypes displaying structural abnormalities either in isolation or in conjunction with numerical abnormalities or ploidy were identified using G banding. This karyotyping was conducted on 46 patients and resulting in an outcome of 44 individual. So their percentage is very high, and 13 out of these 46 patients detected some abnormal chromosome patterns. Within the study population, low hypodiploidy, characterized by a modal number ranging from 32 to 38, and near haploidy, modal number 24 to 29, were absent. The next method that were used is the iFISH analysis, and it was conducted on 84 of the patients, mostly the majority. And their results reveals non-random abnormalities in 39 of their patients. Both gains and losses of the targeted loci were observed either as singular discoveries or in conjunction with fusion and rearrangements. Among the 21 patients identified with gains involving RUNX1, KMT2A, ETV6, PBX1, and TCF3, this either individually or combined. And in their results, it shows that 10 patients exhibited a normal karyotype with no evidence of HHD or the high hyperdiploidy in any cells. And for 9 patients, a karyotype was sadly unavailable, making it impossible to confirm whether these cells has HHD or not. And in their studies, 2 patients have an HHD. Additionally, from the result from the iFISH analysis, patient number 82 was categorized, having an implication on chromosome number 21. And this is based from an established criteria of 3 or more additional RUNX1 signals with a FISH probe targeting the RUNX1 gene. So the most commonly observed chromosomal abnormalities are found in chromosome number 21 and also in chromosome 12. Additionally, a high occurrence of the BCR-ABL1 fusion resulting from the translocation of 9 and 22 was observed. So it is the chromosome 12, chromosome 21, chromosome 9, and chromosome 22 has the high percentage of chromosomal abnormalities. Abnormalities in the 11 Q23 regions specifically related to the KMT2A gene were identified in 3 of their patients solely using the iFISH analysis. The presence of the orange and green signals found in their studies signifies a translocation involving the KMT2A. And the TCF3-PBX1 fusion were also detected by the iFISH and is found also in another three of their patients. An abnormal hybridization pattern would display a one green, one orange, and two fusion signals. As mentioned from the previous slide, the abnormalities from chromosome 21 is commonly found in their study about acute lymphoblastic leukemia. And I further researched about this and I found the article from Berger in the year 1997 from the same analysis using the FISH technique. Abnormalities in chromosome 21 is also observed in ALL, and their occurrence suggests that chromosome 21 plays a particular role in leukemogenesis. And that is all from the results and discussion. Now let us proceed to the last part, which is the conclusion, recommendation, and future directions. And so let us just summarize this. Based from the result of their study, from 91 patients with ALL, between 55 to 89% of the patients exhibit chromosome abnormalities that are detected using the cytogenetic analysis of G banding and FISH. This range varies based on factors such as number of patient studies, reporting year, and the population investigated. Though their finding shows a significant results, one of the limitations that I found in their studies is the small sample size that were used to conduct. Again, they only have 91 patients to examine this kind of disease, and in their cases they failed to obtain the metaphases for analysis using FISH analysis, but thankfully iFISH allowed them to screen large numbers of non-dividing cells. And there is also the need to address racial and ethnic gaps, and also the rise of ethical and health concerns in the cytogenetic profile of childhood patients experiencing acute lymphoblastic leukemia. But again, their study shows great evidence that can contribute to the lack data available in India. And this study is one of the many that will highlight the significance of assessing the cytogenetic profile to enhance the survival rate of children, not just in India, but also around the globe as well. And this is the end of my critique paper. So thank you for watching and listening. That's all.